everyone, how you going? Karen Finnan here, physiotherapist and director of online.physio. So a question that I got asked this week was, who do I not treat with online consultations? What a great question. We're so busy talking about what we do treat and what we can do online, but it's really important to acknowledge what we can't. Now I'm going to talk about this from a physio perspective, but hopefully it gets you thinking about in your health profession, what are the patients that you should be sure that you don't treat online. Now, the first population of patients that we don't treat online are actually the same patients that we wouldn't treat in a face-to-face setting. So these are people that we feel need to see a doctor for reasons such as, even though it may present musculoskeletally, we suspect there may be a medical basis for their issue. If they have things like unmanaged pain and an inability to do their own activities of daily living, that's a concern. If from a physio perspective there are people with neural radiating pains from spinal injuries, so from their neck or from their lower back, that they have sensation changes and muscular weakness, obviously we want them to see a doctor as soon as possible and get imaging done, and basically anything that we feel doesn't comfortably fit into a musculoskeletal symptom and diagnosis bucket. But as I said, that's all the same as a face-to-face clinic. Anyone that we would refer on to a GP for an opinion, we do the same thing when we're online. Now, in terms of the physio sense, where is someone suitable for in-person physio but not necessarily online physio? Well, the reality is these patients tend to self-select anyway. So if somebody wakes up with a crick in their neck and they can barely move, their instinct is they need someone's hands on it. So they're often not the ones that will seek a consultation online. If they did, that is probably one situation, an acute wry neck, where we would get them into some hands-on therapy to help relieve that muscle spasm. The people who tend to approach us are people with injuries that may last a little bit longer, or they're recovering from surgery. And obviously these lend themselves beautifully to the online space with the education component we can give them and obviously the exercise-based rehab program. So they're basically the two populations. Anyone that we feel needs a medical opinion, we won't treat, and anyone who we feel is very acute and needs more timely and hand-specific care, we will refer on. But otherwise, as you well know, education is a huge part of what all health professionals do, and so everyone in some way, shape or form can benefit from that form of education. In the physio world, we're moving much more towards supervised exercise programs as opposed to hands-on care and machines and a reliance on manual techniques. So more than ever, more things are suitable for online care. I hope that's answered your question. Have a think about what that means for your health profession. Be very clear on what you don't treat for just as much as you're clear on what you do treat online. Thanks guys, I hope that's been useful to you. I'll see you next time. Bye.